When should you get your first Pap test? Imagine a simple test that can help catch cervical cancer early before it becomes serious. Knowing when to start screening is key to protecting your health and future. The current guidelines recommend that anyone with a cervix should have their first Pap test at age 21. This applies regardless of sexual activity or other personal factors. The reason is that cervical cancer is very rare in people under 21, with fewer than 1 in 1,000 cases occurring in this age group. While teenagers often have HPV infections, their bodies usually clear these infections naturally without causing cancer. Starting screening earlier does not reduce the already low risk but can lead to unnecessary procedures. These procedures might involve removing abnormal cells that would have healed on their own, and that can sometimes cause complications, especially for future pregnancies. After your first Pap test at age 21, the screening schedule depends on your age and test results. For those aged 21 to 29, a Pap test alone is recommended every 3 years. During this time, HPV testing is generally not part of routine screening because HPV infections are common but usually go away without causing problems. If your Pap results are abnormal, your doctor might recommend additional testing, called reflex testing, which checks for high-risk HPV types. For women aged 30 to 65, there are more options. You can choose to have a Pap test alone every 3 years, an HPV test alone every 5 years, or both tests together every 5 years. The American Cancer Society now suggests that primary HPV testing every 5 years is the preferred method for this age group. Once you reach age 65, screening is usually no longer necessary if you have had 3 consecutive normal Pap tests in the past 10 years and no history of abnormal results. However, if you have a history of abnormal cervical cells or cancer, your doctor may recommend continuing screening. Vaccination against HPV is also an important part of prevention. The HPV vaccine protects against the types of the virus most likely to cause cervical cancer. It is best given before becoming sexually active, but vaccination can still be beneficial later. As more people get vaccinated, the overall risk of HPV-related cancers is expected to decrease, which might influence future screening guidelines. Screening plays a vital role in reproductive health by catching precancerous changes early, allowing for treatment before cancer develops. This can help preserve fertility and overall reproductive health, especially for those planning pregnancy. Remember, these guidelines serve as a general framework, but your healthcare provider can tailor your screening schedule based on your personal health history and risk factors. Always discuss your individual needs with your doctor to ensure you receive the best care for your health.